Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about whether or not you need to be doing the nuchal translucency scan as well as the NIPT test if you are in your first trimester of pregnancy. Now, long story short, it is totally up to you and your provider as to whether or not you guys are going to want to do both of those screening tools. But if you are just wanting to have a screen done for genetic abnormalities, then usually we do recommend either one or the other. I thought that this video would be a good place to just compare and contrast these, as well as talk about some of the similarities as well. So for both of these tests, they are going to be genetic screening tools. What that means is we are going to be able to calculate the risk of whether or not baby has genetic abnormalities based on certain factors that we look at for each test. The NIPT test is a relatively new screening test that we are able to do, and it is using blood work only and looking at the fragments of free placental DNA in mom's bloodstream. So in most cases, the placental DNA is going to be identical to that of the fetus. So therefore, when we draw mom's blood, it is going to have a mix of her own DNA as well as that placental DNA, which again, if it is in most cases the exact same as baby's DNA, we can then go ahead and analyze that to get an idea of whether or not baby has an increased risk of having a genetic abnormality. Both the NT as well as the NIPT test are going to be, again, just screening tools. So they're not going to tell you for sure whether or not baby actually has a genetic abnormality, just if your risk is increased or if it is a low risk of having a genetic abnormality. And with both of these screening tools, there is still a risk of having a false positive result or a false negative result. With a false positive result, this is when the risk comes back as high or higher than usual for having a baby with a genetic abnormality, but in the end, baby is actually genetically normal. Or in the other scenario, there is also the risk of getting a false negative result, as in you come back as low risk for having a baby with a genetic abnormality, but baby then ends up having a genetic abnormality. In my case, for both of my pregnancies, I ended up having a false positive result with both of them, as in both of my NTs were abnormal, but both of my children ended up being genetically normal. And if you wanted more info on that, definitely check out my video on my own personal experience on my nuchal translucency exams. But anyways, these risks are going to be calculated for each of these exams as to whether or not baby has an increased chance of having a genetic abnormality, but it is only through a CBS or an amniocentesis, which are both invasive tests, that you are going to be able to definitively say whether or not that genetic abnormality is present. That's because with those two tests, they're actually looking at fetal DNA, versus the other screening tools, we are just looking at certain factors in maternal blood, or what it looks like on ultrasound, or just those fragments of the placental DNA in mom's blood to get a risk factor, not an actual analysis of whether or not the fetal DNA is abnormal or not. And while both of these tests do detect trisomy 21, which is Down syndrome, trisomy 18, and trisomy 13, the nuchal translucency is also going to be detecting any sort of structural abnormalities that are present at 12 weeks that we can see. And having an increased nuchal translucency, so the thickness of the fluid at the back of baby's neck, can also mean baby has some heart defects or even some skeletal defects as well. And then if we look at the NIPT side of things, as in that blood work only test, not only is it looking at the 3 trisomies, same as with the NT, the nuchal translucency, but we are also going to be able to detect certain other syndromes such as Turner syndrome, Klinefelter syndrome, as well as triple X syndrome. We can also determine gender pretty accurately with the NIPT test. And although at 12 weeks, when we usually do the NT ultrasound, some people say that they can determine gender, it's never really something that we do at the clinic that I am at anyways, and we always do wait until after 18 weeks to be able to see gender accurately. But with the NIPT test, again, they can pretty accurately determine gender as well. And when we compare the NIPT test to the NT test, as in the blood work only to the ultrasound and blood work combined with the NT, the NIPT test does have a lower false positive rate. So it has a lower rate of saying that baby has an increased chance of genetic abnormalities when baby is actually normal. And it also has a higher detection rate for Down syndrome. And just as a little recap, with the NIPT test, that is going to be blood work only. As opposed to the nuchal translucency test, we are looking at 3 factors to determine your risk factor. So we are looking at that fluid at the back of baby's neck, which we would see at that ultrasound. We are also looking at mom's blood work in that time, so we are looking at certain factors to see if they are decreased or increased. And we are also looking at mom's background risk, so maternal age, etc., is also going to be taken into consideration when you're getting your risk from the NT. And again, the NIPT is just blood work only. So in the end, many people just opt for one or the other. In Canada, where I'm at, then the NT test, so the ultrasound one, is covered through our healthcare. So that's why many people get that one instead of the NIPT test, which is going to be paid out of pocket if you are wanting that done here. And although the NIPT test does have a higher rate of detection for trisomy 21 and a lower false positive rate, many people still do go with the NT because, again, not only is it covered by healthcare, but it can also detect any sort of structural defects going on with baby at around that 12-week mark. But it is definitely up to you and your doctor as to whether or not you guys are going to do one or both. But generally speaking, it is seen as redundant to have both tests, especially when you are just checking for genetic abnormalities. So, in the end, for the majority of people, only one of these tests is chosen when you are trying to do a genetic screen for baby.